So, first of all, I want to thank you for being willing to talk with me and allow me to share something with our congregation that will help them make decisions about what our what we should do and when we should do it, as far as kind of re-engaging the life of the church in a person-to-person basis. And so I'll just say that you are Bruce Robistow, and what is your title with the Halifax County Department of Health?
I am the health director of the Halifax County Public Health System.
I see. Okay, thank you. Um, how many? I'll start with this question: how many cases of COVID-19 are in the county right now?
Out of 312 tests that have been done in the county since this started, we have 56 positive COVID ID-19 cases as of this afternoon. And that includes one death related to COVID-19, sadly. 26 of those 56 have recovered and are doing well. And we still have 9 tests that are pending, and we have 247 negative test results out of that entire number.
I see. I see. So those people that were tested, they had exhibited symptoms of some sort, which caused somebody to decide that they should be tested. Was that a primary care physician or an emergency room physician that recommended the test?
All of the above. What the CDC guidelines are is that you should test patients that are symptomatic. And the guidance that we've put out throughout the county is that if you happen to be home and are symptomatic, your first instruction is to call your healthcare provider. So whoever your family doctor is, or PA, or nurse practitioner, whoever you would normally see, is who you would call, not visit. You would make that call, let them know your symptoms, and they would determine the necessity for testing. In the hospital, if you're in the go to the hospital with an illness, and for them, if they're going to admit you, especially, or should you have COVID-19 symptoms, they're going to test you. They test inpatients because they need to know where to put you. You know, if you come in with one thing, say some chest pain, they want to make sure they don't put you someplace that you could either be infected or you could infect others. So it helps the hospital determine where in the hospital you would be admitted. So, but primarily it's for those who are symptomatic.
I see. And what are the list of symptoms that would indicate or seem to indicate an infection?
Well, fever, a low grade fever, 101.4 around there, cough, seizures have been associated. And just today, we just finished listening to Mandy Cohen do her daily update, and they've added symptoms. They've added shaking, chills. They've added a sudden loss of sense of taste or smell. And in general, though, general body aches, general malaise, feeling bad. But the fever is key, along with some of those other.
I see. So, what is the current understanding of how the novel coronavirus is transmitted from person to person?
Through droplets. Droplets meaning a sneeze, a cough, somebody speaking out emotionally, even somebody yelling or laughing hard could actually emit enough droplet to infect others. Those droplets can be direct. We could be standing in front of each other, and if I was to cough or sneeze or laugh, um, they could actually reach you and get into your nose, mouth, or eyes. I could actually cough on a surface, for example, and if you were to touch that surface shortly after I might have coughed there, things like that. There has been a lot of discussion about airborne. Airborne means it just floats around in the air. That has been proven to be a fact, but only in a lab environment. Outside of the lab, there is no documented contamination. So this is a droplet form of contamination.
And droplets do not travel very far as compared to airborne viruses, right?
That is correct. That is correct. And that's why we have the 6 foot distancing. They've determined that 6 foot is a safe distance to prevent droplet contamination.
Okay. So, if I were to ask you, what is the best way for me to avoid getting infected by the virus right now? What would you tell me?
Okay, number one, I'd tell you to stay home as much as you could. And if you needed to go out, I would encourage you to, number one, not congregate with any more than 10 people. Should you congregate or should you not, you should maintain a 6 foot distance from everyone. You should assume everyone is a positive carrier and infectious. I would highly recommend a mask, not for your protection, but for the protection of others. And I would hope that many people would be wearing masks, unless you have an N95 mask that you've been fit tested for, and wear it properly. The mask does not protect you. It does prevent you from expelling any droplets from your body out toward anybody else. So, what would be great if when we all went to the shopping center, weren't 6 foot apart, but if we all had a mask on, we would be fine. The other things to be concerned with is hand washing. Let's say I coughed while I was shopping and it got on my shopping cart, or I coughed while I was looking at the Oreo cookies. You need to be cautious and observe lots of hand washing and or sanitizing, and not touching your face, because again, the other way you can get it, you touch that surface, and then you touch your eyes, nose, or mouth, you could have just infected yourself. And the mask is a good, helpful reminder to not touch certain parts of your body as well. So that 6 foot distancing when you're out, keeps stay out of crowds, keep it less than 10, but still maintain the 6 feet. Wear a mask where you can, and practice hand hygiene. And if you don't have a mask on, when you cough or sneeze, cough into your elbow or sneeze into your elbow like this. Don't reuse tissues. No more handkerchiefs. It's all tissues that need to be disposed of. And that's pretty much it.
What about latex gloves? Do they help in any way?
Latex gloves can help. I'm not going to say that they won't help. So if I coughed on the Oreos and you had a glove on, it's not on your skin. But what happens after that? People that wear gloves get a false sense of security, and you might feel like it's safer to touch your face. Um, but the gloves, unless you wash the gloves while you're wearing them, you're you're still at risk of contaminating. So unless you have an open wound, um, uh, I don't want to say don't wear the gloves. Any level of protection is good. Our first responders, they're wearing gloves and masks and glasses all the time, and they're doing what they can. So gloves can be helpful. It just wouldn't be on my top 5 list of things that I would need to wear while I was going out
Hmm.
and take care of essential business.
Okay, great. Thank you. So, what does being tested for the COVID-19 disease tell you?
It basically tells you whether or not you're positive.
Let's see. Um, so, if you suspect that you've been infected, but you're not sure, how do you find out for sure?
Um, well, unless you're symptomatic, you do not find out for sure. All right. If you're symptomatic, if you feel like you've been exposed to someone, again, you and I are sitting there talking, and I cough, and then I tell you tomorrow that I'm positive. You are suspected as positive. What we would instruct you to do is to quarantine for 14 days and watch for symptoms. And should you become symptomatic, then you would call your provider, and your provider would make the determination then as to whether or not you would need to be tested.
I see. And 14 days is the maximum incubation or possible time for the incubation to take place, right?
That is correct. If you have it, you would become symptomatic. Even if you didn't become symptomatic, you could be carrying the virus, and 14 days would be ample time for that to leave your system.
I see. Okay, thank you. Now, I've been hearing about these serology tests and that they are supposed to tell you if you have ever been exposed and been infected and tell you basically if you've already had COVID-19. Are those things that people should seriously consider investigating?
It's a great concept, but I would not investigate it as of yet as far as a use. These tests that have been studied are not yet authorized or approved. The last study that I read, which was a couple days ago, showed that 70% of the time those test results could not be reproduced. So, for example, if you had 3 of those test kits and you tested yourself 3 different times, you won't get the same result 70% of the time. So accuracy is not quite where it needs to be at this point.
I see. Okay. So sometime in the future that it would be a possibility, but it isn't currently something that is really worth people concerning themselves with right now.
Absolutely. And my concern with that is, let's say it was accurate and you check it and now it says, all right, you are immune to it potentially, or you have the antibodies. That's what it looks for, the antibodies saying that you had it. There's still not enough science out there, valid science, to say that you can't be reinfected. There's not enough science to say that even with the plasma that they're using in extreme cases, taking blood from those that have made it through and are no longer positive, that's still not proven to be effective. It has shown some positive signs, but there's been many cases where it's made no difference in the treatment of someone suffering from COVID. I hate that I can't be super specific on a lot of this, but we're sticking with what we do know, and the recommendations we're making are proven to be effective.
Okay, so we don't know for sure if people who have been infected and have survived the disease can't be infected again. We don't know how long the antibodies stay in a person's system, so that would be some kind of protection. So then, what kind of guarantee is there that we could have a successful vaccine?
Well, vaccines is another great topic. Um, Vaccines have done a lot of things for us over the years, but uh, and then, for example, the flu vaccine. The flu vaccine had a 37% efficacy, meaning that it worked perfect 37% of the time. Not a big number. If you only got 37% of your paycheck, you'd see a difference. However, 37% on the efficacy scale is very high. And using the flu as an example, we get it every year. Hopefully, a lot of us get our flu shot, some don't. We have learned to accept a certain number of deaths every year. So, do I expect a vaccine that will totally annihilate COVID-19? I don't see it. I think our optimistically, I would look for a vaccine that's as effective as the flu vaccine, hopefully more effective, but something that can control it so we can go about our everyday lives. But even during flu season, we have to use precautions. But because we didn't feel the extremity of 100 years ago when the influenza was our last big pandemic, and people, the deaths were immeasurable. So folks that have lived back closer to that time are more apt to understand and get their immunizations. You know, I grew up during the time of polio. I had relatives with polio. Um, so many people, the young, don't know what polio is. So I'm hopeful that we have a vaccine, control this to the point where we can live a fairly normal life. And I don't have extreme confidence that this is going to go away to the point that we will be living like we were April of last year.
Okay, so it sounds to me like we'll be returning to ages prior to this kind of golden age where we had licked most infectious diseases. Now we're kind of back uh, in an age where we have to be aware of illnesses that could potentially kill us, and we don't necessarily have an answer immediately. That's what you're saying, huh?
That's true. Yes. Some things may change permanently. The handshake could go by the wayside. I'm a hugger. I hug everybody.
Yeah.
It's difficult. You know, full disclosure, I had to drop my car off today to have some service done to it. And I saw a gentleman there that I know well and just think the world of, and we shook hands. And as soon as we did it, we realized what we did. We both hand sanitized. And when we shook hands, we almost hugged. Yeah. So I'm your health director. I'm
Yes.
selling this. So uh, there's no science for me to back it, but with the way this is going and my understanding of immunizations and other viruses such as the flu, there's going to be some lifelong changes coming from this.
I see. Can you tell me what herd immunity is?
I can. Herd immunity, in general terms, herd immunity is when an infectious disease actually is either we either have an immunization for it, and you know some diseases we've wiped out pretty much from immunization. So that's one way of having herd immunity. You immunize everybody, and the disease goes away. The other way is everybody gets it, and if we build the antibodies, then potentially we can't get it now. So we pretty much wipe it out from that. But if you think about that, in order to get to that point, that would come at a cost. People would have to die. People would have to get sick. So herd immunity is complicated, and it's something to strive for. And if we ever get to herd immunity to COVID-19, I'm going to hope that it's from vaccine and not from everybody getting it and uh, natural selection, if you will.
Yeah, yeah. Is there a way to quantify it?
How do you mean?
Um, Say, we're waiting until we have achieved this herd immunity to make it possible for us to uh, go back to movie theaters and
Right.
sports
All right.
events.
Well, and again, I listened to Mandy Cohen today, and you know, the initial think, which came from the federal government, was that we would wait until there was a downturn. What the federal guidelines are is if once you have a downturn for a couple weeks, so you've peaked out, you're going down, and your numbers are declining consistently for a couple weeks, then you could consider starting to relieve some of the restrictions. North Carolina now, as of today, is looking more toward because we haven't hit a massive peak in North Carolina. We're doing a good job here. We haven't hit a massive, so we may not look for that downturn as hard. I mean, we'd love to see it, and being able to start to lift some of the restrictions.
I see. So, what would be your advice to our congregation as to when it would be okay for us to have our normal activities like worship and Sunday school and fellowship suppers and that kind of thing?
Right. My best recommendation that I can give or projection is to follow the lead of your leaders. Um, and again, it's hard to determine. Projecting anything with this COVID-19 is difficult, but I'm optimistic if we can get things to flatten out. I can tell you, all of your elected officials, appointed officials, do know that everybody wants to get back to it. I don't know anyone who was involved in the decision making for this that isn't eager to lift restrictions as quickly as possible. So my recommendation presently at this present time is to stay the course. We need to watch these numbers a little longer. On the 8th of May, by the 8th, some big decisions are going to be made. And I have optimism that some of the restrictions will be lifted. However, what's going to make it work so we can get to the next phase of lifting, and the next phase is we need to continue to follow the rules as they're set. So right now there's no congregating. It's 10 people, and a good amount of people are following this. And this is why we're not peaking. This is why it's not out of control. So once we put our best minds together with what little data we have and we start lifting some, we need to stick to those. We need to not, well, I think we can do this. And that's my best advice, is to stay the course, follow our leaders, follow the instructions of our leaders, and trust that if we see things continue to improve, that things will continue to live. But at the same time, we're going to be ready to recoil if we start lifting things and all of a sudden numbers start to spike. So so the biggest thing I'd say is stay the course, follow the guidelines of our leaders, and educate. You and I are talking, and you're going to share this with your congregation. It's like sharing the word, my friend. Everybody needs to go out and share this and tell this. Don't be afraid to tell someone who is encroaching on your space to please step back. Or if someone coughs into the open air, don't be afraid to remind them. You can do it kindly. You want to teach. You know, I try every media platform we have here. I can't go to your congregation and speak, so I'm glad you're doing this. I can't go into school to do this same similar thing with students now. I'm on the radio, I'm in the paper, I'm on our spin. But if you share this and everybody in your congregation tells all their friends, their relatives, their whoever, everybody they run into, help each other to learn that this has got to be a team effort. We all have to participate, and encourage people to want to do so. Encourage patience. There's nothing harder than telling folks on Sunday that they can't congregate. And but I appreciate everybody doing that. I know God has His master plan for all of us, and I'm a firm believer in that. But I also know that He leaves us to make some decisions, and I don't think we're going to be. It won't be held against us for not going to church. We all know how to pray at home. We know how to communicate. We can communicate now better than we ever could. Follow the rules, and we'll get through this.
Director Robistow, thank you so much.
You're very kind. Thank you for this opportunity.